Hi, it's Dominic from Shift.ms, and it's Tuesday, the 24th of March, 2020. I'm in Oxford in the UK, and our guest today is joining us all the way from Ohio in the United States.
Howdy.
Please tell us a bit about yourself, what you can do, what you do, and why you're so well known in the MS community.
Well, it's an absolute pleasure to get to talk to you. We've followed each other on the interwebs for quite some time, so it's a pleasure to be here chatting with you today. My name is Aaron Boster. I'm a multiple sclerosis neurologist in Columbus, Ohio, in the Midwestern United States. I made a decision as a small child to become an MS doctor because of a family member impacted by this disease. I'm the founder and president of a MS center called the Boster Center for Multiple Sclerosis here in my hometown, where we care for people impacted by MS and their families.
Aaron, a lot of people with MS are quite scared right now, and we do appreciate your help, and we'd like you to help MS patients around the world, starting right now.
That is a wonderful goal that we share. It is a scary time. We're in a time of a pandemic. No one in our lives have ever faced anything like this. And yet we want to remove undue fear and stress and anxiety. And I think that education is really the key to that.
Yeah. Aaron, we've had a bunch of questions from our community, really the global community, because Shift.ms is no longer just a UK site. We have fans of yours from the United States. We have people from Saudi Arabia. We have people from Australia, Canada, all over the place. Okay. If I can just jump straight into some of the questions that they've put to us. It's probably one of the first ones is, how can I differentiate between my MS symptoms and the COVID-19 symptoms?
That's an excellent question. When I think of COVID-19 infection or upper respiratory tract infections, I think of a constellation of symptoms that are not similar to classic presentations for multiple sclerosis. So, for example, I'm looking at someone who has a fever, someone who is newly short of breath, and someone with a cough. Now, yes, there are other features that you can see in the setting of COVID-19, but it is uncommon that a person impacted by MS would present with MS symptoms as such. Now, we know that people with MS that develop a fever can have a worsening of their baseline symptoms, but fever, shortness of breath, and cough are things that I would look for to help differentiate, hey, I'm not dealing with an MS flare, I'm dealing with something a bit different.
What do we know, or what do you know about the risk factors like smoking, obesity, and stuff that play into this whole COVID-19 thing? Does it make a difference, things like that? There's, my MS, there's this whole intertwining of these various things.
I think anyone impacted by MS is going to ask a rational question. Does my MS make me more at risk to contract COVID-19? And does my MS make it so that I am at risk of a more severe infection if I contract COVID-19? So let's deal with both of those in turn. Having multiple sclerosis in and of itself is not an increased risk factor for contracting COVID-19. COVID-19 is an infection that you get from droplets, and having MS or not having MS won't change that risk. So it's very important, in my opinion, that people impacted by MS realize they're not at increased risk of contracting COVID-19 just because they happen to have MS. Now, as it relates to severity of infection, if someone contracts COVID-19, the concern is that some people have a severe infection. And just to throw out a couple baseline statistics, 80% of people with COVID-19 are going to have a mild flu-like illness. They're not going to be hospitalized. They're not going to need medical attention, as it were. But about 15% are going to need medical attention. And somewhere around 5% might even need intensive care unit attention. And as it relates to MS, having MS by itself is not an increased risk factor for severe disease. If you have very advanced MS and it's impacting your mobility and your ability to clear what we call pulmonary toilet, or clear deep breaths, it is a risk factor for a worse disease, in the same way that any severe illness would make grappling with a viral infection more severe. So the vast majority of people who have MS are not at increased risk of a severe disease just because they have MS. It is relevant, however, to talk about the disease-modifying therapies, and maybe we'll field that question next. But there are certain MS disease-modifying therapies that increase the risk of a severe infection. Others, not so much.
I was hoping that you could share with us what the neurologists around the world are doing to share their knowledge, especially through the use of these registers. In the UK, we have the MS register. I know they're doing research in Italy now, but really, why are these so important to patients and why should they take part?
So, trying to answer the question of could a novel, brand new illness, or in this case, infection, make a condition worse is a challenge because we don't have data. We don't have years or even months of experience to help guide us. Multiple sclerosis impacts millions of people worldwide, but the vast majority of folks don't have MS. And as a result, it makes a rather small population to study. So identifying people impacted by MS who have contracted COVID-19 and trying to track how they're doing, what their outcomes are, is going to be one of our best opportunities for learning so that we can then turn around and help other people. You've mentioned some outstanding efforts in Great Britain, also in Italy. There are some registries being put together where we're asking people impacted by COVID-19 who have MS to write in and tell us. We're asking doctors caring for these patients to create these registries so that we can then data mine them and learn. I would say that in a much more loose fashion, even in social media, we're making efforts. So hashtag MSCovid19 is a Twitter hashtag which we're trying to keep specifically for information about MS and COVID-19. And as I look at my Twitter feed throughout the day, there are outstanding neurologists, many in Italy, that are sharing anecdotes about their patients. Now, in the hierarchy of scientific information, anecdotal information is normally not so good, but in this instance, it's extremely informative. And I just want to convey to you how engaged the MS treating community is in trying to help our patients and their families stay safe and balance the importance of managing MS with the safety with this infection.
From all of us at Shift.ms, we're incredibly grateful to you giving up your time so early in the morning at work with coffee, I agree, but still to help people out globally because this has suddenly stopped being a local thing. It's a global thing.
That's exactly right. And we're all in this together. This is a community of people that care for one another. And it's my honor that I get a chance to talk to you. Best of luck and thank you for chatting with me today.